Welcome, welcome, welcome back, Be Health Empowered family, to another week of Excuse Me, Doctor. We are here every Monday night, so thanks for joining us again tonight. Happy Monday to everybody. So we are here. We're going to kick off this amazing week that we're going to create for ourselves. You know, we are here every week to talk about health topics and bring them to you based on the science so you can be confident and empowered when it comes to making decisions for you, yourself, and your community. We clarify speculation, we clear up misinformation, and we debunk disinformation. We're on YouTube and Facebook. Thank you for the newbies who are joining us for the first time. If you haven't done this yet and you're on YouTube, please hit that red subscribe button. And if you're on Facebook, please hit that like button. Love you for that. Thank you so much. So tonight, I know a lot of y'all have probably tuned in for this really, really important topic, Black women and fibroids. You know, the vast majority of American women are expected to develop uterine fibroids at some point in their lives. But, you know, despite its prevalence, there's a lot of misunderstanding, misconceptions, non-understanding about fibroids and what you can do to prevent them, or if you already have them, what sort of treatments are available. And so we're going to be demystifying this. We're going to have a wonderful panel who's going to discuss this with us tonight. And, you know, get your questions ready because I know you're going to have them. And remember, share this with all the women you know who may be dealing with fibroids and have some of the symptoms that you all, I'm sure, have heard about. Urine problems, fertility issues, back pain, and more. So you definitely don't want to miss this, and tell your girlfriends to sign in right now because we're going to be doing it very shortly. But in the meantime, before we jump into that, you know we have to bring you my two wonderful co-producers, Mr. Wayne Bruce and Miss Lila Mays. Thanks for popping in, y'all.
Hey. What's going on? Lila sound good and strong.
Y'all, if y'all only knew how Wayne be working my nerves before we come on camera with technical stuff.
Good and strong up in here.
She is back and better than ever.
Well,
Welcome,
we had
welcome.
to get it right. We have a grant. Well, we'll get to who we have, but they're recording artists and stuff like that. So
Yeah,
sound
we got an all-star. We have an all-star
Sound
cast of
has
y'all
to be
tonight.
right.
So I hope y'all are ready.
I hope you're ready. I'm excited.
Absolutely. So let's hit this recap, y'all.
All right. We ain't got no recap music, so you got started, Dr. Mill.
All right. Well, we always start off with the number of COVID cases. We're at 43.4 million. And you know what? I actually have some good news for y'all. We reached a high point in terms of COVID cases on September 13th at 166,000 cases a day. But since then, the number of new cases every day has dropped by 13%. We're down around 106,000. It's still a crazy number, but at least we are having a sustained downward trend over the past week or two. And it's the most consistent decline since back in June. So this is pretty good.
This is great.
I feel good. Hopefully we'll be able to sustain this. Of course, we have to look out for the holidays coming up and the cold weather, and more people are going to be going indoors. So we still have to be doing our precautions, our masking, our social distancing, our testing frequently, especially before going, and traveling for Thanksgiving, etc.
Yeah.
We're at 8,300 hospitalizations a day. So of those thousands and thousands of cases, 8,300 people are getting hospitalized every day. That rate has dropped too, thankfully. We're down to about 14% drop. Deaths also too have dropped by about 3%. We're at 684,000 deaths since the beginning of the pandemic in the United States. And last week we talked about 12,500 people since we last talked, there have been 12,500 deaths from COVID. So that was just last week. But like I said, we're finally trending down with deaths. So again, all good news in terms of keeping our fingers crossed that this trend continues.
All good news. So what are we looking like with the vax facts? Are those numbers up?
Yeah, so we're close to about 185 million people vaccinated. That's 65.1% of all eligible people who could be vaccinated. So that's everybody over 12. But that's the fully vaccinated number. And we now know the Kaiser Family Foundation did this little poll, and we know the top 3 reasons for the recent numbers of people getting vaccinated. So number 3, I'm going to do this as a countdown. Number 3, personal connections to those who have been ill or died. So actually seeing the horror of how bad the disease can be up front. Number 2, hearing about the recent run on hospitalizations and how it's keeping people from, being able to get care. That's number 2. And then number 1 is just the Delta variant itself and people being concerned about what it could do to them. So those are the top 3 reasons now while people are getting vaccinated.
Okay, I'll take it. I'll take it. That. And who's not getting vaccinated, Dr. Mill?
So we're seeing that rural areas, people that live in rural areas, have almost twice the number of COVID hospitalizations and deaths as metro areas. So we know that the rate of vaccination in rural areas is much less than that in the urban areas. We know that schools in affluent areas are more likely to encourage vaccination, and as a result, kids who live in school or live in areas who go to school in affluent areas are more likely to be vaccinated. And then this week, for the first time, the percentage of Black people getting vaccinated and the percentage of white people getting vaccinated are roughly equal, about 70 and 71%. Latinos lead both of them at a slightly higher percentage. But we still know that there are unvaccinated pockets in both Black and especially rural white neighborhoods where some of these vaccination pockets, less than 30% of the people are vaccinated. The majority of the unvaccinated, 60%, lean or are Republican. So there you have it. That's who's not getting vaccinated. And of course, we've heard of the firefighters and the teachers and the, hospital workers, people quitting their jobs rather than getting vaccinated, which is confusing.
A little bit, since they're in the business of saving lives.
Right.
But, okay.
You would think.
Yeah.
Maybe they'll take. Maybe they'll take.
Deep. It just shows you how deep and pervasive this disinformation is going, where it's even tricking the people who are supposed to be saving lives.
Wild. Wow. Well, maybe those people will be interested in the COVID pill that is on the horizon. Yes?
Yeah, well, maybe they will be. I'm sure y'all have heard by now that Merck is going to be seeking emergency authorization for its new drug, molnupiravir. And they think it might be, ready before the end of the year. And they've shown, they did a study of about almost 800 people that it can cut, by taking this medication early after diagnosis with COVID, so for mild to moderate COVID, that you can cut the rate of hospitalization in half by 50%. It's 40 pills. So 4 capsules twice a day for 5 days. But it's cheaper than the monoclonal antibodies. It's less cumbersome because you don't have to go to a hospital and get hooked up to an IV. It's not as effective as the monoclonal antibodies. Those are 70% effective at keeping people out of the hospital. But that's still pretty good because, all it will require is a prescription and you can take it at home. But my concern is that people might see this, like you said, those people who might be interested in it, and not get the fact the vaccination is still the best tool against COVID.
Yeah.
Because this is a treatment. This isn't preventative. This is to treat it after you've been diagnosed.
Right.
Exactly. And those of y'all who listen to me regularly, y'all know that I love my analogy. So this is my analogy, which some of you may have heard. So imagine that, COVID and all this is a car accident waiting to happen. Masks and social distancing are like traffic lights. They prevent accidents from happening. They prevent COVID exposure. Vaccinations are like seatbelts. So you want to have them on before you get in the accident. So before you get exposed to COVID, they won't prevent you from getting into an accident. But if you are exposed, meaning if you do have an accident, you got your seatbelt ready, and that's going to prevent you from being ejected from the car and possibly having serious bodily injury. And then finally, treatments or medicines are like the airbag. So it deploys after the accident happens. The damage is done. And so you don't want to have to wait and use and rely on an airbag. So the other thing regarding these medications and not relying on them versus COVID, number one, like I said, it's not going to be available till, right away, maybe not till the end of the year. And then as far as spread, medications don't prevent you from spreading it from other people. There was a study that was just released this week that definitely shows that vaccination decreases spread by at least 60%. So that's really key.
That study was done out of Oxford, right?
Yes, exactly. Yes. It was done in the UK.
I'm just saying. I was up on the study.
My producers are on it.
Come on now. we here with Dr. Mel. We have to know something. All right. So, the question everybody asks, though, because we're going into flu season, is can I get the COVID shot or the COVID booster and the flu shot at the same time? So
apparently, yes, you can. Research has found that it's safe for people to get a flu vaccine and a COVID vaccine at the same time. It's advised that you get them in opposite arms. The side effects are mild to moderate, and immune responses to both the flu and the COVID vaccine were robust when they were given at the same time without having any, negative impacts. And the people, they actually asked the people their opinion, and they were so satisfied that 97% of them said they would be willing to have 2 vaccines at the same appointment in the future. So, yes, is the answer.
Okay. All right.
Okay.
So we're good with that.
Yeah.
So look.
And a lot of people have a question about when to get their flu vaccine. October, early November is kind of the ideal time. So before flu season gets rip roaring, but at a point where you're sure that the immunity you get will last through flu season, which typically ends in late April, early May.
Well, thanks so much, Dr. Mel. So I have a friend of mine call me with them. Everybody calls me because they figure, I have all this medical knowledge.
Or you stayed in a Holiday Inn last night.
Or I stayed at a Holiday Inn with the doctor last night. But they asked me, a friend of mine called me about their migraines. And did I have any treatments or did I know of any treatments for migraines? And I told them, no, I don't have any treatment. I'm not a doctor.
Good answer.
So, Dr. Mel, do we have anything with migraines?
Yeah. So if you know any migraine sufferers out there, if you yourself are one, there's been some new research around diet and migraine prevention. So it shows that diets that are higher in omega-3 fatty acids, and the ones that there are a bunch of them, but the ones that are specifically found in fatty fish like salmon and mackerel can reduce the frequency of severity of headaches in people who get frequent migraines. And our modern diet tends to be low in these beneficial or good omega-3 fatty acids, EPA and DHA. Those are the ones that are found in the fatty fish, and high in what are called omega-6 fatty acids. The one specifically of concern is linoleic acid. And it's been shown that by having the diet high in the EPA and DHA, so the happy omega-3s, and a diet low in the omega-6s, that you actually can prevent the number of migraines you have, how severe they are, and the number of days that you have migraine per month. And so the researchers concluded that pain can be treated through dietary alternatives, and that this might actually open the door to, doctors incorporating this in how they treat migraines.
Wow. Very interesting. And
Yeah,
for those of us who suffer from migraines, that's very, very
Yeah.
interesting.
Wow,
Stock up on that salmon and mackerel and sardines.
Indeed, brain food anyway.
Sardines. Hey, and pork and beans.
Oh Lord.
I'm just saying.
For you
gut health.
non-DC go-go folks in the audience, he's singing a go-go song.
Right. Gut health, maternal microbiome. Let's break it down for the people, Dr. Mill.
All right. Well, maternal just means pregnancy. The microbiome is so a lot of y'all know, our intestines or our guts are full of both beneficial as well as some harmful bacteria. And the bacteria themselves are not necessarily all good all the time or all bad all the time. It depends on the context. So some bacteria might be great for some conditions and not so great for others. So it turns out that gut bacteria in pregnant women may influence how well the nutrients that the baby needs are absorbed. And that in turn may relate to being able to carry the baby to term, so not having the baby be born early, or having the baby being born at an ideal weight. And they found that certain bacteria help to release energy from harder to digest foods, and therefore provide an important source of nutrient to the mom and therefore to the baby. And so a healthy prenatal healthy prenatal diet that includes fish, nuts, eggs, green vegetable, whole grains, and conversely low intake of white bread, sugar, full cream milk, red meat like hamburgers and processed meat like hot dogs and bacon, that if you lower numbers of that, lead to a higher diversity of helpful bacteria in the mom's gut, hence the maternal microbiome. And it also seemed to point to the fact that moms who had a greater bacterial diversity were more likely to have children who had robust psychological development as well. So lots of important information linked to diet.
So moms who eat a lot of bacon, your children might not be as robust.
I wouldn't go that far, but there was a correlation seen.
I mean,
so
I'm just
the
saying,
takeaway is
if you eat McDonald's and bacon, constantly, it may be a problem. Be a problem.
Exactly. But talk to your OBGYN and find out what they say about your ideal diet.
Right. So you know what time it is, La? Do you know?
I do.
Do you know? Do you know, Dr. Mill?
I know what time it is.
The weekly debunk. Stop misinformation in this tracks.
So our debunk day comes from Tyrone Twitter Fingers. Tyrone says, my employer better not ask me if I took the vaccine, because if he does, I could sue him for HIPAA violations. Cha-ching.
I don't know. Twitter Fingers Tyrone. Dr. Mel, is this true?
I don't think Tyrone is going to have much success with that angle. And this is why. So for y'all who don't know, for those folks who don't know what HIPAA stands for, HIPAA is the Health Insurance Portability and Accountability Act. It was passed many years ago, and it's a federal law that requires standards around protecting sensitive patient health information from being disclosed without the patient knowing and without the person's consent. So it generally applies to anybody who processes health data. So health providers, health plans, health IT companies. So some people like Tyrone are under the mistaken impression that requiring workers to disclose their vaccination status goes against this HIPAA law. But that is not true. It has been proven to be false. The U.S. Health and Human Services Office for Civil Rights said that the HIPAA privacy rule does not apply to employers or employment records. That means companies are not infringing on their employees' legal privacy by asking them to reveal their COVID-19 vaccination status. And, we're in a pandemic, y'all. And companies have every right to, ask for vaccinations for their employees to protect other vulnerable employees and potential customers by asking for a proof of vaccination. So I don't think this is going to work out very well for Tyrone.
I don't think so.
Tyrone, you might have a shot at a HIPAA violation. but not HIPAA. Tyrone has been debunked again. Thank you, Valerie Spalding Parker, for that. Twitter fingers has been debunked again. There she goes.
Hi, Valerie.
So, Lila, our time has come.
I think it's come to an end, right?
I thought our time has come to an end.
Well, thank you all for joining me. And I'm going to see y'all back. So, don't go too far. Right. We are about to go into our main topic for today. And that's all about uterine fibroids. A quarter of Black women between the age of 18 and 30 have fibroids. And that's compared to only 7% of white women. By age 35, among Black women, that number increases to 60%. So it's more likely that a Black woman at age 35 and above will have fibroids. And if y'all watch MSNBC, there's a journalist, African-American woman on there. She's excellent. Her name is Tiffany Cross. She just recently, a few days ago, mentioned her journey with fibroids and the many symptoms that she's endured before finally getting definitive help. So today we have two incredible guests who are going to guide us through a discussion meant to inform and empower Black women as we think about our health as it relates to uterine fibroids. Our first guest is the incomparable Dr. Lynne Lightfoot. She's an outstanding board-certified OBGYN who's been in practice in Washington, D.C. for over 16 years. She cares for women from adolescence through menopause and beyond. She's been consistently named as one of Washingtonians' best doctors, and that's probably why she got the shout out from Tiffany Cross, and because she was Tiffany Cross's OBGYN and took excellent care of her during her journey with uterine fibroids. So welcome, Dr. Lightfoot. Thanks for being here tonight.
Thanks for having me. Thanks, Dr. Mel.
Absolutely. We have a second wonderful guest. Her name is Carolyn Malachi. She's a mix engineer, producer, educator, and Grammy-nominated artist who teaches audio production courses at Howard University. Her research there explores the intersection of blockchain technology and data sonification. I have no idea what that means, so I am not going to mess with this sister because she is bad with what she does. We are so grateful that she is here tonight and is going to be sharing her journey as a patient dealing with uterine fibroids. So, Carolyn Malachi, thank you so much for joining us tonight.
Dr. Mel, it's wonderful to be here. Thank you for having me.
Absolutely. Well, we're going to jump right into it. First of all, we have to level set for the audience just so everybody knows what we're talking about. So, Dr. Lightfoot, can you break down for us what are fibroids exactly?
So fibroids are benign tumors of the uterus. They, more than likely, they are benign. Most of the times they are benign. They're the most common tumor in women. And they actually look like cauliflower. So just imagine irregular bunches of cauliflower in your front yard. and just big white bunches. And some of them can be very small, some of them can be very large, and they can cause any number of symptoms. Most times women don't know that they have them when we actually diagnose them in the office.
Wow. So, and when you say benign, you mean harmless, meaning that they don't, most 99% of the time, don't progress to be something cancerous, right?
Correct. So they are not cancer-causing tumors, although they grow uncontrollably. They are not cancer-causing tumors. They don't cause terminal illness.
Got it. So, Carolyn, can you tell us a little bit about your journey with fibroids and how they have affected you? What kind of symptoms you've had?
Sure. I have, a few years ago, I was having like pretty significant cramps, and I ended up getting a UFE, which is pretty common. And then most recently, I just noticed, I guess over the years, I've noticed like a bulge. Like no matter how much I worked out or, changed my diet up, there was still like, just a presence in my lower abdominal area. So I went to get it checked out, and my, OBGYN said, hey, this looks pretty serious. You probably need to, have some tests done. And it's been a pretty challenging journey. I've had to work with a few different doctors to get to a place where I can make a decision about my health. But I've learned a lot by doing research, and currently working with a specialist to help me resolve the issue.
Okay. You mentioned UFE. Dr. Lightfoot, can you break that down for us, please? What is UFE? That Carolyn mentioned she had that as a treatment first.
So you had a uterine fibroid embolization?
Correct.
Is that what you had? Well, one of the a non-invasive treatment or less invasive treatment for fibroids is to block the blood flow that's actually going to the uterus and to the fibroids. The blood flow that's actually feeding the growth of those fibroids. And so one of those procedures is a uterine artery embolization.
Okay.
How did it go for you?
Well, I have to have surgery, so and very interestingly, it resolved the pain issue, but not. And I guess this is a space where we can be candid. I mean, half the world is comprised of women as well as men, so I don't feel uncomfortable discussing these symptoms at all. But while that procedure did resolve the issue of pain, it did not resolve the issue of heavy bleeding. So I'm ready to not deal with that. It's at a point now where like there are days where I just have to stay home. So for those of us who are out there in the world and we have periods, can you imagine like every month of your life, you can't leave the house? And I'm a performing artist, I'm an engineer, I'm an educator. I literally cannot afford that.
Yeah.
So you have to do something different. It's about quality of life, and also, I have family goals, so I'm just trying to, do the right thing here.
Well, balance all of those things.
Bring up, yeah, definitely. I mean, and that's totally understandable about how it's affecting your quality of life. Before we get into some of the other treatments, Dr. Lynn, can you break down what are some other symptoms that you've heard women have? So Carolyn mentioned cramps, heavy bleeding, pain, sort of like a swollen lower abdomen. What are some of the other things that you've seen?
So I try to classify those symptoms as abnormal bleeding, bulk symptoms, so symptoms where you feel pressure forward toward your bladder. You may have pain in your back, or you may have pain down, like just down towards your lower pelvic region, without being too graphic. And all of those symptoms can can manifest themselves differently in different people. Some people have a lot of pain when they urinate or difficulty urinating. Some people have difficulty with their bowels, symptoms that are similar to irritable bowel syndrome. Some women have a lot of abnormal bleeding. And over the course of one's reproductive life and after, those symptoms may vary depending on the location of the fibroids. So fibroids that are on the outside of the uterus, we call them subcerosal fibroids. I have a little model here. You see that?
All right.
People?
We got pictures, y'all.
There we go.
Yep.
There we
you
go.
go. Right there is perfect. Yep.
Okay, right there. So these fibroids right here, over here, this is what we call an intramural fibroid, and it has some subcerosal, SUBSEROSAL. I think it's important for us to know what we're talking about. So just so I can be clear. This fibroid, it gives you bulky symptoms, right? It makes you feel big. Your uterus feels bigger than it should. You're like, what is that I feel inside of my abdomen? So that's an intramural or subcerosal fibroid. This fibroid in here, right here, I feel like I'm playing Atari, right here, that is a submucosal fibroid, SUBMUCOSAL, submucosal fibroid. These fibroids cause irregular bleeding because they're in the lining of the uterus. And the lining of the uterus is important to us because this does impact our fertility, and it also impacts our bleeding. So you're going to bleed heavier if you've got submucosal fibroids. Think of a submucosal fibroid. I describe it as a rug. You have a room that's like 8 by 8, and you bought a rug that's 8 by 10, and you get a big rock or a buckle in the middle of the room. That buckle can either be a polyp or it can be a fibroid because the space is only so big, but the lining that lines the space is actually larger, so you get heavier bleeding. So these submucosal fibroids have a mind of their own, and they bleed on their own. And so you often hear women complaining of periods that are lasting 7 to 10 days, or they may get bleeding in between their cycles. So you get your period on day 1 through 7, and then you start bleeding again around maybe day 15, 16, or 17 because the fibroids have a mind of their own. And quite often, Black women don't often complain about their irregular bleeding pattern because, as I say, we are the salt of the earth and take care of our mothers, our fathers, our sisters, our brothers, our cousins, our friends, and we're the last person. So we feel like our heavy bleeding, oh, well, this is just heavy. Doesn't everybody change their pad 3 times an hour? No, they don't. But unless we ask all of those questions, we don't really get all of that information.
Wow, that was an excellent rundown. And just to break down, intramural means in the wall, like you saw in the model. And one thing I don't think we've also touched on is painful sex, right? That too, fibroids can also lead to painful sex as well. And I know that too is can be one of the symptoms. What are some of the treatments, Dr. Lynn, when it comes to fibroids? Carolyn mentioned UFE, and we broke that down. And we also sort of broke down that it might not work as a long-term aid, and it might not work completely, right? So break down some of the other options for us.
Having a hysteroscopic myomectomy, so removing the fibroids that are on the inside of the uterus by going into the uterus with a camera. It's hystero, Hystero, scopic, SCOPIC, myomectomy, removing the fibroids. That is also non-invasive. It doesn't require you having any incisions on your skin, and it's an outpatient procedure, so you go home the same day. An abdominal myomectomy, where we make an incision on the abdomen and you're being opened up, we go in and we remove the fibroids. We essentially cut the fibroids out of the uterus and then repair the uterus. Another procedure is a laparoscopic myomectomy, where we put a camera in your belly button and attempt to remove the fibroids and cut the fibroids again out of the uterus, and then repair the uterus, and the uterus remains intact. Another procedure, which is a rather new procedure, something called Accessa, and that is radiofrequency ablation of the fibroids. through a laparoscopic procedure in the abdomen. That's a relatively new procedure and seems to be effective. It's not yet recommended for women who desire future childbearing because studies still haven't indicated that that's a safe option, but it is an option.
But it could potentially save you from surgery, from having an
Correct.
incision, like you mentioned.
A larger incision.
Yeah. And then, of course, hysterectomy, which is a sort of definitive final option because it removes the uterus altogether, right?
Yes, a hysterectomy.
Right.
Which historically has been the case for many African American women. They've resorted to having a hysterectomy because sometimes if we feel like that's our only option, it solves the problem. Mm-hmm. It stops the bleeding, it stops the pain, it stops the pain with intercourse, the pressure symptoms, but it is definitive and it does have other consequences.
Right, like not being able to have
make
children.
the right, exactly. Yeah. So you make the right decision that's best for you.
Right. And, sometimes, doctors don't go into as much detail as you just did. What was your experience, Carolyn, in terms of, hearing those different options and the pros and cons? What did you take away from your encounters with doctors?
I went to, first I chose the doctor because she was a Black woman, and I was really disappointed when I did not receive the treatment that I expected to receive. I was not educated about these many options. I wasn't asked questions like, do you want to harvest your eggs, for other types of, childbearing. So I did switch doctors. I do audio production for a podcast that happened to produce an episode about fibroids, and one of the doctors that we spoke to suggested seeing a specialist, and not just an OBGYN who focuses on broad, feminine issues. So I switched and I saw I'm now seeing a specialist, and I feel confident that she is going to be able to treat me properly. But it has been quite a journey to get to the person who I trust as a patient. My previous doctor, who I think failed me, she didn't even, I did several tests and she didn't review the results of the tests with me, and not thoroughly. So I gave those test results to another physician and she went through me point by point and told me what was going on. So I think the lesson that I've learned is it's okay to get a second, third, fourth opinion in order to get to the person who's going to give you what you need. It's okay to be your health advocate. We have to be our own health advocates.
And I did not coach you at all. I just wanted to be clear. But I have a book called Excuse Me, Doctor, I've Got What? Taking ownership of your health and making health care work for you. And it's all about being your own best health advocate. And I talk about the fact that, yes, it is fine to get a first, second, third, and fourth opinion. I always say get at least 3 because you can get you'll therefore have a tiebreaker if you get an odd number of opinions, and it takes time. But when it's for something as important as what you've been dealing with, Carolyn, and women who are trying to make decisions about controlling all these symptoms, plus also the possibility of future fertility, it's really, really important. I want to get to, because we're going to have to bring our producers back in with audience questions soon. I want to talk about prevention of fibroids. What can you share with us, Dr. Lightfoot, when it comes to prevention of fibroids? And say, for example, you have that UFE procedure and you're able to control some of the symptoms, but the fibroids will likely grow back. Are there things that women can do to lower the risk of recurrence, or at least slow it down?
there's still research out there to identify what are some concrete things that can be done that will actually decrease the prevalence of fibroids. There are lots of hypotheses about diet, and there are some studies about exercise. Birth control pills do decrease the growth of fibroids, although people often think that birth control pills are causing fibroids, so they're not causing fibroids. Fibroids are, they are fed by hormones, the hormones that our body makes. There are some risk factors that are associated with them. So things to pay attention to are, people that have had many pregnancies beyond 20 weeks are less likely to have fibroids. So people that have pregnancies later in life and have fewer pregnancies after 20 weeks are more likely to have fibroids. Women that start getting their periods before the age of 10, so they are more likely to have fibroids. Having a healthy diet and being active is a benefit for your overall health. And seeing a doctor that knows you and is familiar with you so that you get the right information at a time when you need the right information, I think is really important. And not being so overwhelmed with our symptoms that we want our symptoms to be better, but we don't know the consequences of the procedures that we have done and how that may impact. When you're in your 20s, you think, oh, I've got bad fibroids, I'm really uncomfortable, let me do this procedure so I can go on with my life, and not thinking about or not being told or informed that may have an impact on your fertility later. I think those conversations don't get had with us at times, and that's prevention.
Yes. Great. Thank you. And so I got a ton more questions to ask, but I am going to go to our audience. And of course, to do that, Wayne and Lila, can you come on back and bring in some audience questions for us?
Sure. I think I'd like to make this one statement. I want to thank all you ladies for bringing this to light. I am the odd wheel in this, but I just told Lila, we have a back channel of talking, that I just told Lila, and I'm reading all these comments from women and from Lila. I mean, Lila has her own journey, and I'm reading all these comments, and I said this because all of them. I mean, I can't imagine what you all go through. I can only imagine, but I can't imagine, the horror of some of the things I've said. And I said this because we are a masculine society or male-dominant society that if it was happening to a man's penis, it'd be fixed. It'd be fixed
a long time ago.
A long time ago. And I ain't saying it to laugh. I'm dead serious. Like it would have been fixed. I just can't imagine. So I'll let Lila bring in some of the questions, and she might have questions as well.
The number one question is, why is there such a high incidence in women of color? So
Dr.
that's
Lightfoot?
on every platform we're on.
Yeah, Dr. Lightfoot, can you maybe give us some ideas on that?
There's just recently, I think it's Bill 6383 that Yvette Clarke just brought forward to provide more research and funding exactly for that reason. We don't know why African American women, why Black women are getting fibroids more than anybody else. Hands down, all the time. It's always been the case. 70% of Black women get fibroids, and we don't see that as frequently in white women, and we don't know why. We don't.
Okay.
I'm sorry. I wish I had a different answer. I don't.
Dr. Mel, you have anything to add?
Well, I've seen theories, and again, as Dr. Lightfoot said, they're just theories; they're not proven. But everywhere from the increased stress of racism and possibly poor diet to theories about hair relaxers being associated with fibroids. But again, they're an isolated study here, an isolated study there. There hasn't been really large definitive studies to say for sure that these factors have a bearing on the frequency of fibroids in Black women. And so I'm glad to hear that bill has been introduced. I think hopefully if it gets passed, we could really get some answers.
Okay. I have a two-parter, and I just want to put this in the space. I think this conversation is hugely important. My mother never talked to me about her fibroid issues. I just knew she ultimately had a hysterectomy. Knew my grandmother had a hysterectomy. Knew my aunts had hysterectomies, but they never told me why. And so I was completely unprepared for what ended up happening in my late 20s, early 30s, into my 40s. Had no idea. So I hope we have more conversations around this kind of thing. So in terms of what causes them, Dr. Lightfoot, you said that for women who've carried babies, carried children for a certain amount of time, are less likely to have them. Are women who have terminated pregnancies, are they more likely to have fibroids? And then the second part of that is, do things like coffee, caffeine, other foods we may eat or drink that are caffeinated, do they contribute to the growth of them?
So caffeine does not contribute to the growth of the fibroids. No.
Okay.
And the
right.
right. We need our coffee, so you're good.
You still stop at Starbucks on the way to work.
Right. The data says that women who have carried pregnancies beyond 20 weeks of gestation, they see increased or decreased fibroids in those women. That does not mean that if you've had more pregnancies under 20 weeks, that's the opposite. So the inverse is not necessarily true. And we don't know if that's an association. We don't know if that has to do with fibroids and hormones. We don't know what that is actually attributed to. So it's only data that says that beyond pregnancies beyond 20 weeks provide you with a positive outcome. Does that make sense?
So in other words, it's not necessarily tied to having had an abortion.
Correct.
Right.
Okay. I have a question from Tammy Shui. What percentage of fibroids turn cancerous? Do you recommend partial or total hysterectomy?
Dr. Lightfoot?
So making a decision between a partial versus a total hysterectomy is not necessarily correlated to whether or not the fibroids are potentially malignant or not. So each individual is different, so we couldn't make one overwhelming statement. It is a smaller percentage of fibroids, and they are called leiomyosarcomas that can be malignant or cancerous to the degree in which we need to be more aggressive about treating them. Those are typically fibroids that grow in less than 6 months or in 6 to 12 months, and they do have a certain characteristic to them when they're seen on MRI, or if there's a biopsy or a specimen where a pathologist is someone that looks at slides of tissues under microscopes, and they can make certain identifications and make classifications about those types of cells when they look at it under a microscope. Those are the ones that are more cancerous, but it's a small percentage.
Okay, we have a question from YouTube, Lila.
Okay.
Does sanitary products affect fibroids? Nura
I would
Green
imagine
Lane.
they're probably specifically talking about tampons.
Okay, Nura Green Lane.
Thank you,
Nura Green Lane.
So no, tampons do not increase the chance of fibroids. There are certain products that have been associated with an increased risk of fibroids. Some of those are PCBs, and women that have been exposed to DES in childhood, they are at increased risk of fibroids, but those are different types of fibroids.
And can you say where PCBs come from? Those are the things found in plastics, right?
Right. And electrical products and engine products, things like that.
Yeah.
selling us anything to put in
Not
our
the things
bodies.
you're working with, Carolyn. Not the things you're working with.
Mm-mm.
Thank you,
Not,
doctor.
not those kind of electrical products. She's like, electrical products.
Yeah.
Carolyn, this question is for you. This is from my sister Sylvia saying, when she went through her journey, she was actually told not to share any stories about her journey, particularly in Christian community, right? Because it's so intimate. The question for you is, what made you so transparent in your social media posting about your story?
If we're really being honest, I wanted people to know that the podcast episode was out. But
Okay.
Good reason.
if we're really being honest, but also, I come from a family that encourages communication, and we've always this fibroids have been, I guess, part of our lexicon. You know, since I was a kid, there are certain things that are normalized, like you're gonna have heavy periods. Your mama had heavy periods. Both your grandmothers had heavy periods. All your great grandmothers had heavy periods, so you're gonna have heavy periods. So we just talked about it, at least among the women. So like my aunties, my grandmothers, they always made sure that I knew. I'm the firstborn of 3 kids, so I've always been the kind of person that wants to make sure that everybody else is okay. So having this conversation um, is is not very difficult for me, because I feel like if I talk about it, then some maybe that'll liberate other folks to talk about it who have felt silenced by it. And
Right.
also, I can't hide it anymore. Prior to COVID, when I was doing shows, like I would, as a matter of fact, even during COVID, during performing virtually and then posting the content online, in both scenarios, prior to and during, I would have people text me or send me DMs to say, "Hey, is that a baby bump that I see? Are you preggers?"
Oh, wow.
No.
Mm.
I mean, I appreciate it, but no, those, it's something that I have to deal with. So, also, I just, wanted people to know, you don't have to send me congratulatory cards, because I mean, unless you want to congratulate me for getting this surgery
Right.
that's about to happen, because these things got to go.
Or for
I need
being
to
a
be on
Grammy
tour.
nominated performer. That
Right.
that that is also a good reason to send you congratulation cards.
Well, God is good. Thank you.
Well, no, thank you so much for sharing, and I'm very glad. I mean, that your family ethos, that your family means of communication is one of the things that led you to be comfortable talking about it. Because, like you said, if we don't talk about it in forums like this, then a lot of times people will not get the information that they need. So I'm very grateful that you are sharing. Um, we talked a lot about heavy bleeding, Dr. Lightfoot. Is there any does hydration play a role? Is there anything that people can do to mitigate the pain and the cramps that come along with severe fibroids?
The bleeding can lead to anemia and being iron deficient anemic to the degree in which one needs a blood transfusion. So staying well hydrated is a positive. It's something that we should definitely do, but at the same time, it's not going to prevent the anemia. At some point, you have to identify and say, this amount of bleeding that I'm having is too much, and I need to do something about it, especially if one starts feeling lightheaded and dizzy. Taking ibuprofen, NSAIDs, which are non-steroidal anti-inflammatory agents, but to be in layman's terms, Advil, Motrin, Motrin
Naproxen.
IB, Naproxen, Aleve. Those are agents that specifically target prostaglandins and inhibit the release of prostaglandins, and it's prostaglandins that are actually causing the cramping and the pain. And there are times when those things don't work anymore. At the same time, you don't want to take too much of them because they can also cause you to have gastritis. or, some severe irritation and damage to your gut. But at the same time, it does help. Those are the things you should start with. People often say, oh, I took Tylenol, it didn't do anything. It won't do a lot. So the Motrin, Aleve, Advil, they help significantly.
So,
Right.
In researching this show, and when we were talking about it in a producers meeting, Lila shared with us just her journey. And I mean, I've been her friend for quite some time, and it was amazing for one, and just incredible that you went through so much, Lila. So,
Yeah. I mean, these stories are the comments. I can relate to almost everything that Carolyn has shared. Almost every comment or question in the chat, I can completely relate to. I had to have a transfusion, Dr. Life, and my doctor actually called me. I had labs maybe 2 days earlier, and he called me at work and said, "You need to get here. I don't know why you haven't fallen out in the street. You are that anemic." And so I had to go have a blood transfusion that night.
Thank goodness.
Yeah, but
Thank goodness.
Thank goodness. But, kudos to Carolyn's family, who the women talked about what it was. We got to share with the generation coming. We have to share this stuff and prepare. One of the questions, I know we're running way out of time, but one of the questions, ladies, is, do we know if women on the continent in Africa, the motherland, do they suffer from these same issues?
To the same degree, like the statistics that I mentioned.
To the same degree.
Yeah, 60% of African-American women over 35 have fibroids. So, Dr. Lightfoot, do you know, is that the same worldwide, especially for women on the continent?
I do not know. I don't.
Okay. That's an excellent question. And that's one of the questions that, research would help to elucidate some different. We know for maternal mortality, for example, Black women have 3 times the rate of maternal mortality, but we know that recent African immigrants don't have that same rate of maternal mortality, but within one generation of being here, their statistics jump up to native-born African-American women. So, when we look at fibroids, being able to compare different populations can also help us understand some of the reasons. So gosh, y'all have been just incredible. And I can't believe we're out of time. This went by way too quickly because I know there are a bunch more questions. We're probably going to have you back at some point to talk about this. But I just want to, summarize and thank you all again. Dr. Lightfoot, Carolyn Malachi, thank you guys so much for joining us tonight. You were fantastic. And love the visual aids. If y'all missed that part of the show with the model of the uterus showing the different fibroids, y'all need to rewind and check that out because it was super helpful. And, I think one other thing that I heard a common trend is just that, we as women and we as Black women, oftentimes we carry the burden of the world on our shoulders and we push our own needs, down to the bottom of the priority list. And we might drag around with pain, with lightheadedness, with super heavy periods, and not tend to ourselves. And I always like to remind everybody, treat yourself like a baby left in your care, number one. And number two, just like they say on the airline, you have to put on your own oxygen mask before you can take care of the person sitting next to you. So I want to leave everyone with that. Thank you again so much to my wonderful guests, Carolyn Malachi and Dr. Lynne Lightfoot. Thank you, as always, to my fantastic co-producers, Lila Mays and Mr. Wayne Bruce. If you are up tomorrow morning, I'm going to be on the Russ Parr Morning Show at 7:46 a.m. Eastern Time. Going to be answering lots of his questions that come from his audience. So tune in for that if you can. And if you're not going to be able to do that, and I'm not going to see you until next week this time, please remember, be wise, be well, and be health empowered. Thanks for joining us. Thanks for your wonderful questions, and take care.